There's a lot of confusion with toddlers. Many parents are worried about their toddler in terms of their language development, their imitation, their tantrums, and they are concerned that their child might have autism, but they're hoping for the best and, in a lot of ways, putting their head in the sand and hoping that everything just works itself out. Today, I want to talk about the MCHAT, the Modified Checklist for Autism in Toddlers. And this is a free tool that you can use to see what the red flags are for autism so you can get out of denial and into action. Hi, I'm Dr. Mary Barbera, autism mom, board certified behavior analyst, and best-selling author of The Verbal Behavior Approach, How to Teach Children with Autism and Related Disorders. I fell into the autism world in 1999 when my firstborn son Lucas was diagnosed with autism one day before his third birthday. But I actually fell into the autism world a year and a half earlier when my husband, who's a physician, first mentioned the possibility that Lucas might have autism. I was really freaked out. I had just had my second son, Spencer. I was stressed. I had no idea that my husband was thinking anything about Lucas's delays. Lucas had some skills. He lost some skills. It was winter time. I had a new baby. I didn't want to hear the word autism, and I pretty much told him that. And I just hoped that things would work itself out. After Lucas was diagnosed with moderate to severe autism right before he turned 3, I started looking at the early warning signs of autism, and I was really angry at my pediatrician for not knowing the signs, not telling me, at the speech therapist who was falsely reassuring me. I was angry at myself for not looking into this sooner. As a mom, having my first son, I didn't really know anything about development, and I didn't know that that was my role to worry about a child's development. The rate of autism now used to be, when Lucas was diagnosed 2 decades ago, 1 in 500. It is now thought to be 1 in 59, or even as low as 1 in 29, some studies are showing. So the rate of autism is higher. The waiting lists for evaluations are higher. So more people, they're not only in denial, but they're having to wait and worry while they wait and trying not to panic, but at the same time, their children are not getting the kind of therapy they need to make real gains. So today I wanted to talk about the MCHAT, which stands for the Modified Checklist of Autism in Toddlers. And it is valid for kids ages 16 months to 30 months of age. And it is something you can print out off the internet at mchatscreen.com. And it is simply a list of 20 questions that some pediatricians do the MCHAT. The pediatrician that cared for my sons, they incorporated the MCHAT after Lucas's diagnosis and after I went on a mission to educate physicians in my local and state area. So they do the MCHAT at the 18-month well visit as well as a 24-month well visit. They have parents fill out the screening tool in the waiting room, and then they can see if anything looks suspicious. And if there are red flags for autism, they can then get them to an evaluation, hopefully as soon as possible. So some of the things on the MCHAT, they are just simply yes and no. And it says in the directions that if your child rarely does things, to mark it as a no. They should be, for example, pointing a lot. I know I recently did a video blog on pointing, so you may want to check that out. But there are a few of these 20 questions that deal with pointing, that ask, does your child point with his index finger to show you things? Does your child bring you things to show you? Does your child if you point across the room to a stuffed animal or to the TV or to grandma, say, "Look, Johnny," and you point, does the child's attention go in that general direction? Does your child pretend or make believe is one of the questions, which pretend play is very delayed in kids with autism usually. It also asks about unusual things like moving their fingers in front of their face, near the eyes. It also talks about, does your child, if you smile at him or her, does he smile back? Does he have eye contact with you? If you just turn your head and look at something, will the child then follow your look to see what you're looking at? Does your child understand when you tell him or her to do something, like go get your shoes? I remember when Spencer was a baby, he was probably 6 months old, and Lucas had just turned 2. We brought in a photographer to our house to try to take pictures, and the photographer gave Lucas a little film canister. That's how much I'm dating myself. This is back in the late 90s. So he gave him a film canister, an empty one, and said, "Can you throw this in the trash, buddy?" And Lucas just threw it, on the floor and went about his business. And I thought, well, he doesn't understand that. But a child at the age of 2 should understand simple directions, like throw this in the trash or go get your shoes. And it also talks about walking, which studies are now showing that kids with autism can often have physical delays like walking late. And do they enjoy movement activities? Are they hypersensitive to noises? So I do think that if parents download this MChat at mchatscreen.com, it'll give you more information if your child is seeing signs of autism. I also wrote a short ebook several months ago called "Is it Autism, ADHD, or Typical Toddler Tantrums? 3 things you can do today instead of worrying." Those 3 things are to know the milestones for ages 4 months up to the age of 5. Know when your child is supposed to sit up, crawl, walk, put 2 words together, point to things, pretend play, imitate you without you telling them to, start to answer WH questions, start to sing songs. This is all in regular developmental milestones. So one is know the milestones for each step and compare your child's abilities to those milestones. Step number 2 in my free ebook is if you do see delays, get help. Make a sick appointment with your pediatrician, your child's pediatrician, because there's often no well visit between the ages of 2 and 3, and a lot of people are waiting and worrying, waiting for that next well visit, which could be a couple of months away, is never a good idea. Make an appointment, speak to your child's pediatrician, also speak to your daycare providers, see what they think about your child's delays. And the step number 3 is to learn about ABA. Applied behavior analysis is the most proven treatment for autism, but it's also great for kids with speech delays, ADHD, or even typical toddler tantrums. And you can find out more about ABA by attending a free online workshop at marybarbera.com/toddler workshop. I hope you enjoyed this short video blog, and if you can leave me a comment, give me a thumbs up, share this video with others who might benefit, and I'll see you right here next week.